Please welcome Dr. Paulo Alves, MEDAIR's Global Medical Director of Aviation Health, MEDAIR International SOS.
Thank you very much. Good afternoon, everyone. I think you can hear me well. Great. So yes, it's a quick talk about the aspects of health and health support in space missions as we are getting there. So of course, the commercializing of outer space will certainly require some precautions about the people that we are sending up there. And of course, this is, should be something top of our mind. And typically, it's an afterthought for most people that we've been contacting is a secondary thing after technology and everything. So, but first of all, it's thank you so much, Tina, and for this opportunity to be here. Thank you so very much, much appreciated. And of course, when we say the missions that are coming, they are so different, right? So you have now stratospheric balloons. You have suborbital, very short ones. You have some that are more, extended for days, 8 days, and of course missions to to the moon and to Mars and to different planetary bodies. And of course, they will entail different challenges that needs to be thought of and addressed. Our company, just so you know, we've been providing services, ground-based support for the aviation industry, commercial aviation, business aviation, also in the yacht segment and commercial maritime. So we've been accumulating quite a bit of experience over the past 30 to 40 years. And I became the data person, the person studying those events and trying to understand as much as possible so that we can develop products and services to address those events. And they all have in common, regardless, in any remote environment or here, basically what we see is, the elements of a medical event, they gravitate around, 3 big elements. The person, the environment, and the time of that person exposed to that environment, right? Of course, time alone just, would provide us with the component of chance. So yes, if we observe, if we are waiting, something would happen just as a function of time. But person and environment, they interplay as well. So, for example, when we say aviation, commercial aviation, we are talking about, the cabin altitude. When we're talking now space, it's now we are talking about a totally different environment. But the common denominator here will be person. And one thing is when we think about, highly selected individuals going to those missions, and a totally different thing is when we are allowing, people like us going up there. Right? For one reason or another, because we have the money to pay it, or because we are doing some research. But now, all those selection mechanisms are not in place any longer. And meaning that, okay, so now we are talking, and this is actually, I always repeat this, flying is not bad for your health. And if you're healthy, you can fly forever, and you're never going to get an in-flight medical event. But the reality is that we are aging, and again, we cannot control underlying health conditions to 100% degree of certainty. Even the highly selected astronauts, we have, and we have modeling of the probability of medical events. And here and there, we had a few medical events, despite all the triage that was done for them. So, but now the person here, takes an enormous amount of importance, because we are dealing with underlying health conditions that are prevalent in the general population. And of course, if we just factor in the time issue here, then yes, even for astronauts, you cannot predict something that is going to happen 6 months from now, from your checkup, so to speak. You can say, well, the risk is less. if you do, all kinds of tests, but you cannot predict exactly what's going to happen. Meaning that, as we know, something will happen. That's, of course, it's just a matter of probability. And even a low probability event, it will happen at some point. And then the point here is, how could we, number one, prevent as much as possible? And if not able to prevent, how could we mitigate and how to address those situations? So this is coming from our experience. Of course, as I said, the more you experience and the more you witness those events, because again, they are part of human nature, and actually they reproduce the demographical prevalence of diseases in the general population or in some subgroups of the population. And of course, if we have, and I should have said, I'm a cardiologist by training, so with my cardiological bias, one of the most important, emergencies is when you suspect a heart attack. A heart attack, as of today, the treatment, it's basically you have a blocked coronary artery, and the blood supply wouldn't reach the muscle is going to die. So we cardiologists, we used to say that time is muscle, because yes, the longer the time not relieving this blockage, the more muscle will be dying, and therefore the chances for the person to have a bad quality of life from that point on. So we can even think about it. So we need to have a means to diagnose effectively if someone is having a situation that could be addressed, depending on the mission, so that we can better characterize the situation and even, retrieve the person, if at all possible, depending on the kind of mission that we are talking about. But it is actually doable. We have this goal as cardiologists of having someone in the cath lab within 2 hours, ideally. 6 hours, okay. And can we retrieve someone from a space station within 2 hours? Yes, we can. So, but we better, diagnose it precisely, because you don't want to do, all the things that are that you need to entertain for, oh, you know what? It was not a heart attack, right? So you need to have also the ability to truly diagnose those situations. And of course, another aspect that we've been involved here and there is the launch site support. So a final, in aviation, we say that, there is a mnemonic that we use to practice, and it should be actually practiced even more frequently as a true checklist, that I'm safe, right? So am I okay in regards to my health aspects right now? Do I am presenting any symptoms? Do I have any drug that I had to take, in the last few hours or something like that? So to make sure that I'm absolutely fit for the mission ahead of me. So, and then the medical support for the staff working in launch sites, because some of those launch sites, not the case here, will be sometimes remote for certain, for example, some balloons, some stratospheric balloons launches. They want to launch from a already interesting touristic point. So because those balloons are stationary, so you need to have all the infrastructure right there at that point. So those are another components that you need to factor in, and services that can be provided in this scenario. And another thing that is absolutely paramount, we don't know, and again, it will depend on the type of mission. What kind of training should the crews, if any, or the passengers should undertake to be, how could I say, the delivery end of this equation? Because, of course, we can provide medical advice and analysis remotely. You just need to establish a communication link, but someone needs to be right there. So, and that person should receive some training. And so the definition of training, the definition of equipment, those are discussions that we need to take, as soon as possible, and I would say immediately. In a previous talk here, Maybe it's not a person, maybe it's a robot or something, right? But definitely those decisions need to be made, because then we need to train how to equip the robot and so forth. So I would say that those are actually exciting times. And of course, if we are relying on a person or even a robot, you need to understand how to guarantee, good victim assessment. What are the skills that should be trained to proficiency? Because if we establish a risk matrix about medical events, remote, you can see what is frequent and severe, what is rare and severe, what is infrequent, frequent and not severe, and what is mild and not severe. So thanks God there is nothing that is frequent and severe. And who cares about what is mild and not severe and not frequent, right? So who cares? But you need to address those that are frequent, even if they are not severe, because they can evolve into something more serious. And you need to train to proficiency and have adequate equipment to address those situations that are rare and severe and life-threatening, time-dependent. So this is actually the rationale which should guide us around this equation. And speaking of that, yes, cardiac arrest is the utmost, emergency that someone can have. Therefore, they need to be trained. And oh my God, exciting just to think about what is the best method to perform CPR in microgravity, for example. How exactly, we should do that. And of course, we didn't have any case so far. And don't quote me on that, but I mean, if it fails, then you need to know and have a procedure what to do with the deceased body. I don't know, for example. So all those things needs to be considered for successful missions in that matter. So I spoke a little bit about that. So the equipment that you need to have. For example, medications, right? So they don't behave the same in microgravity. Not only the pharmacodynamics, but even the application of some injections and things like that. So the formation of bubbles if you are drawing from a syringe. So those things, I mean, the more I think about it, the more auto-injectors and the more nasal sprays or things that can be administered, easily for someone, with a minimum training. Those should be the goals for developing an adequate medical kit to be carried, and of course knowing how much space and weight will be important right there. So medications for the most common ailments in there, and of course resources to save a life as needed. So. And again, this is what we've been doing. What kind of training should a doctor or anyone providing remote assistance should have in flight for those missions? And I'm a firm believer that if you agree with me that the person is the most important point in that triangle, so emergency medicine should be the first layer of this layer cake. And of course, the superimposition of knowledge of the environment. But if you don't know what is happening with people in general, then you cannot adapt to this that person in that different environment. So I'm a firm believer that more than anything else, the first foundation of a doctor providing remote assistance is the triage mentality of an emergency physician. And that's what we've been doing, for the past few years, as I said. So, and then, of course, we need to think about recovery site support, medical support, because conditions that can happen, not only accidents, but things that if you recover, particularly if you're retrieving someone after a medical event in one of those missions, you need to have this support locally to expedite final care. So, in summary, we need to have to get a resilient operation. You know, of course, planning and action are absolutely paramount. You know, how to prepare life-saving medical equipment, the training, you know, the crews, and even the passengers, depending on the mission, and to have a very well designed and thought emergency response plans, and then, you know, the ability to respond and to recover. In other words, to prevent, to mitigate, and to recover as needed. So with that, I think that closes my presentation. I'll be more than happy to, you know, to take any questions if you have any. Still have some time. We got one.
So what will be the organization that oversees certifying different medical professions and so forth?
That's a very interesting question, because so far there is none, right? In the aviation, how could I say, environment, there is no actual jurisdiction. What happens as of today is that the captain has the authority to make you know, a kit to be open and things like that. So the crew, I mean the medical team on the ground is just recommending to the captain what to do. So this is the legal framework, right? But in space, what is the jurisdiction? Very good question, right? We don't know, right? And as we don't know actually anything about this, right, from the morning talk. But very nice point, yeah. But again, from the technical standpoint, I would always recommend emergency physicians certified as such, and then that should receive additional training on the specific environment they are supporting. Okay. Dr. Orford.
Assuming that there's an emergency, let's say in 20 years from now on a commercial space station, and you need to return that person to Earth, tell me a little bit about the mechanics of how that would happen. Where would they go? How long would it take to get appropriate medical care? I can see that this is going to present a lot more problems, and there's already problems with airlines, but in space, I would think that this would be more difficult.
And that was exactly what I was researching when we bumped into each other. Yeah, to my surprise, actually, you know, the right answer, as anything in medicine, is it depends. So it depends where the thing will land, right, ultimately. But apparently, you know, it could take less than 3 hours from ejecting from the space station to arrive in sometimes 2 hours. Of course, now, you know, you're gonna land where? You know, it will be a splashdown, so you need to have, of course, the retrieval ready as well. But again, it's between 2 and 3 hours, and then the final time to the hospital facility will depend on the location. Surprisingly low, isn't it? From the space station, I mean, right? Forget about the other side of the moon. Okay, well, thank you so very much for your attention. Thank you, Tina. Thanks.